Already more than halfway through the semester. So welcome to today's session, to Civic Lab Toronto curriculum session focused on community resilience, people, housing, and neighborhoods. And I think this is a topic that many of you are really excited about. We've gotten a lot of questions about this topic throughout the different sessions, so this will be great. And I'll begin with a land acknowledgement. As this meeting is both in person and virtual, and we are not all gathered in the same place, I recognize that this land acknowledgement may not be for the territory that you are currently on. We ask that if this is the case, you acknowledge the traditional territory you are on and the current treaty holders. For those of us in Toronto, I'd like to acknowledge that the land we are on is the traditional territory of many nations, including the Mississauga of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississauga of the Credit. So I'm Aditi Mehta, Assistant Professor of Urban Studies at the University of Toronto. I'll be the moderator for this session. And to provide a brief description of today's event, many of you are already familiar with what's going on, but the Civic Lab Toronto curriculum is presented by Strategic Partnerships and the City Manager's Office within the City of Toronto in collaboration with the 8 higher education institutions represented here today. And actually, before I continue, I'd like to take this opportunity to congratulate Dr. Sarah Diamond, who was invested as a member of the Order of Canada for her revolutionary work bridging the fields of art, design, and technology. It's pretty incredible, and we're very lucky to be here with her today. And civic leaders from the city and the higher education institutions across the city are forging a path of partnership and innovation between our organizations. And this work includes the development of a new model for the city and academia to collaborate on multi-partner, multidisciplinary research to inform policy and programs. And we're thrilled to be hosting this year's Civic Lab TO curriculum in Council Chamber after a really tough year. And this is a very unique learning space to be in, and we're really excited to be sharing this opportunity with our partners. So a tremendous amount of planning between the academic institutions and the City of Toronto has gone into delivering the Civic Lab TO curriculum. The City of Toronto secured an amazing lineup of senior staff and policy experts for each of the sessions, and thank you to all of our partners who have made this possible. So before I pass it on to our guest speakers for today's session, I want to cover a few housekeeping items. So today's session is being recorded, and participants are asked not to share any personal information within the meeting. And this session will be available on www.civiclab.ca or www.civiclabto.ca/curriculum and made available to your instructor in the near future. And if you have joined us in person at Council Chamber, welcome, and please note that we ask that you avoid joining the virtual WebEx webinar. And the washrooms are located in the hallways by the elevators, so that way over there. And there will be time for questions and answers at the end of today's event. If you're joining the session virtually and would like to submit a question during the session, please enter it into the Q&A feature at the bottom right-hand corner of your screen. And if you are joining us in person and sitting in the council members' chairs, you may speak into the built-in microphones. So to use these mics, press the yellow button until it lights up to activate the mic. Once your question is asked, please press the yellow button again until the light turns off to mute the mic. And we also have a wireless microphone, which can be brought to your seat. Just raise your hand and someone from the team will walk the microphone up to you. Again, we remind you to avoid disclosing any personal notes when asking your questions. And lastly, everyone joining us virtually will be manually muted during the event. And if you are in Council Chamber and have joined the WebEx meeting, please do mute your device's speakers. So as I said, I'm really excited to be your moderator for today's session about community resilience. Before I moved to Canada quite recently to become a professor, I worked in community development and housing in the post-disaster context in the United States. So I'm really looking forward to learning from the experts we have in the room today. So today we're going to hear from Stephanie Malker, who's the Manager of Strategic Programs for Shelter Support and Housing Administration, Sonia Bourgeois, Director of the Toronto Drug Strategy for Toronto Public Health, and Kanchan Maharaj, the Senior Engineer for Cycling and Pedestrian Projects for Transportation Services. So we will begin with Stephanie Malker, Manager of Strategic Programs, Shelter Support and Housing. Thank you, Stephanie.
Hi, everyone. I'll admit this is my first in-person presentation in a while, so it's it's odd, I have to say, but I'm sure I'll get used to it. So I just wanted to first introduce myself. My name's Stephanie Malker. I'm the Manager of Strategic Programs, focusing on a specific piece of work called Coordinated Access, which I'll get into in some more detail in a moment. I do want to acknowledge that I'm a white settler on Indigenous land, and I'm also an immigrant from Naarm, or a city which is commonly known as Melbourne in Australia. My pronouns are she and her. So I wanted to start a little bit with my background before I get into the work of SSHA. So I have an undergraduate degree in health promotion and exercise behavior. Once upon a time, I thought I was going to be an exercise scientist in a lab, and that did not happen. After I finished my undergrad degree, I was hired into a kind of social work position, and then worked for 5 or so years as a frontline worker in various housing and homelessness type programs. So from eviction prevention, working directly with people who are at risk of losing their housing, to a number of supportive housing environments, working with people who had formerly long experiences of homelessness, helping them to kind of maintain their housing and prevent any return to homelessness. I then moved to Toronto and did a Master's of Urban Planning at U of T. And from there, got a job with the City of Toronto at Shelter Support and Housing in 2017 as a Policy Development Officer, and moved into more of a leadership position a few years ago. So the work that I do with SSHA is primarily focused on connecting people experiencing homelessness with housing and supports to help them stay housed over time. So the work that I do really sits between the work of the Housing Secretariat, who are responsible for creating housing and supportive housing, and the work of SSHA, who are responsible for delivering homelessness services in the City of Toronto. So I'm going to start first, just the next slide. I'm going to start first with a little bit of an overview of kind of the strategic work of SSHA before I get into some program specific details of the work that me and my team do. So the city has a homelessness solutions service plan, which was approved by City Council last year, which is designed to guide our work over a 3-year period. It was built on kind of extensive engagement with frontline staff, service users, people with lived experience of homelessness, as well as informed by a lot of data around homelessness in Toronto, including data from our street needs assessment, and really identifies priorities over the next 3 years with the primary goal of ending chronic homelessness. So by chronic homelessness, for people's reference, we mean people who have been experiencing homelessness for 6 months out of the past year, or for 18 months out of the past 3 years. That's the definition that the federal government use, and the City of Toronto's definition aligns with that as well. So SSHA's service plan, just the next slide, thanks. SSHA's service plan aligns really closely with the city's housing TO action plan for creating affordable and supportive housing. So specifically, the work of SSHA is aligned with one of those strategic directions around preventing homelessness and improving pathways to housing stability. And the work of me and my team is really focused on that, on those pathways to housing stability and connecting people to housing that meets their needs, so that they can maintain that housing in the long term, and we can create that reduction in chronic homelessness. So just the next slide. So there are 6 implementation priorities in the service plan that we have. I'm just going to move this to here. We have a significant focus on advancing reconciliation, which is supported by ongoing relationships with Indigenous service providers and service users. We have another kind of guiding document called the Meeting in the Middle Strategy and Engagement and Action Plan, which was designed in really close partnership with our Indigenous service providers. And there are a number of commitments identified there to be upheld by both the City of Toronto and municipal staff, as well as our Indigenous partners. And there's a real commitment to meeting those commitments and really following those very strongly through all the work that we do. So that's reflected here in the service plan. There's also commitments to addressing anti-Black racism and recognizing the intersectional experience of people who experience homelessness. So that work aligns with the corporate strategies for confronting anti-Black racism. And I'll talk more about this kind of intersectional approach to homelessness when I talk more specifically about my work as well. So next slide. So in SSHA's strategic plan, we also have identified 2 kind of key outcomes to measuring progress towards these goals. So one is around having access to safe and high quality emergency shelter services. I'm going to focus a little more on the second one because it's more closely related to my work. Next slide. And that's around providing housing-focused services that are rare, brief, and non-recurring. So we kind of recognize that while homelessness may not ever be completely eradicated, and there's always going to be a need for some sort of emergency homelessness services, when people do experience homelessness, it shouldn't be for very long, it shouldn't be very often, and it shouldn't happen to them again. So we do have, I wanted to highlight kind of one of the key tools that we have, and you can just flip to the next slide, for measuring some of this work. So I'll maybe try and share in the notes or something that goes out afterwards, the link to what we call our shelter system flow data. So this is a dashboard that's available on the City of Toronto website that really helps us and supports our ability to measure our progress towards this non-brief and rare, brief, and non-recurring goal. So information here is really telling us about how people flow into our shelter system and how they flow out of our shelter system as well, which is a really critical thing to understand as we do program design and develop policies and then run kind of operational programs as well. So it's one of the most comprehensive and robust dashboards about people experiencing homelessness across North America. And it takes, we designed it and developed it really to, in line with some best practices, guidelines given by the federal and provincial government, as well as the Canadian Alliance to End Homelessness and the work that they're doing to address homelessness across Canada as well. So just to specifically highlight, and you can just quickly flick through the next few slides, but this measure of rare, we're looking at reducing the number of people who are newly identified as experiencing homelessness each month. Oh, maybe there's some slides missing. Anyway, you can just go back a couple. And then the brief, so reducing the number of people who are experiencing chronic homelessness, and then non-recurring, which is reducing the number of people who are returning to homelessness after they've moved to permanent housing. So I do want to go in a bit more detail about the work of my specific team and the work that we do around using a coordinated access approach to connecting people experiencing homelessness to permanent housing. So just the next slide, thanks. So, a lot of this work is guided by direction given by the federal government, by provincial government, and through kind of these municipal strategies that we have in place, the Homelessness Solution Service Plan, the Housing TO Plan, but there are also lots of other plans that we take into consideration too. So the Reconciliation Action Plan that was recently approved, the Poverty Reduction Strategy, the Toronto Seniors Strategy. There are lots of kind of corporate level strategies that we look at and then look to integrate into our work to make sure that we're also contributing to achieving these other kind of municipal and corporate level goals. So really, next slide. So really at the core of it, using a coordinated access approach to connecting people to housing and supports really is reliant on two different things. And this is kind of where my work sits between those two divisions of the Housing Secretariat and SSHA. So the first one is around creating new permanent housing with supports. And so that's really the work of the Housing Secretariat. They have a 24-month plan in place to create 2,000 supportive homes in 2021 and 2022. And so, you know, I've just listed above here a number of the programs and opportunities that people who are experiencing homelessness have to move into permanent housing. This year, you know, so far as an example, we've connected over 700 households with follow-up supports, which are kind of mobile supports who of really skilled caseworkers who we contract within the community to support people as they exit homelessness. So someone moves into a new unit and they're connected with someone who can provide them with support around their rights and responsibilities as a tenant, kind of community orientation, that kind of thing. So we've connected over 700 households so far this year to those supports. And we also know that that over 400 households have been connected with housing through our Rapid Rehousing Initiative in partnership with the Toronto Community Housing Corporation and now also the newly created Toronto Seniors Housing Corporation. And so that program connects people with housing. The units are furnished, so we work closely with a community partner called the Furniture Bank to create a home for people to move into, which has proven really successful and you know, is obvious when you say it, but there's a huge difference from moving from a shelter into an empty home, into an empty apartment, than moving into an apartment that has a couch and a TV and a fridge that's stocked and, you know, all that kind of thing. So moving people into those homes has been really successful, and we've moved over 400 people this year into those units. So the second part of the system is really about that moving people into those units and how we actually do that. And that's a huge part of the work that my team does. So we're, you know, responsible for developing tools and strategies and processes that really effectively and efficiently connect people experiencing homelessness with those housing and supports. And there's really three components to that work. One is around understanding who is experiencing homelessness. So when we know who's experiencing homelessness, we can develop specific strategies and specific approaches for different population groups. So we know, for example, that Indigenous experiences of homelessness are different from other experiences of homelessness, and that's particularly true for Indigenous women. We also know that the experience of homelessness for youth is different from the experience of homelessness for adults. So we want to, by understanding who's homeless, we can design and develop tools and strategies to best meet their needs. The second piece of work, next slide, thanks, is really about understanding the needs of people who are experiencing homelessness. So we want to make sure that we're connecting people to housing and supports that really meet their needs and make sure that they're able to maintain their housing in the long term. It's inefficient and it's not a good experience for the person who's moving to housing, nor the system for someone to move into housing that is, you know, where there's not enough supports and their risk of returning to homelessness is really high. We want to prevent that from happening, and understanding their support needs is a key part of that work. So We've worked really closely with frontline staff and service providers, including importantly, Indigenous partners, to create an assessment tool to understand the needs of people experiencing homelessness. There are a number of tools kind of out there across the sector that can be used. And the City of Toronto has developed their own tool, recognizing the importance of kind of listening to our partners and making sure that we're creating a tool and a system that works for them, rather than bringing in something that maybe works in another community but may not work for us. So that's the second piece of the work. And the third piece of the work is really about prioritizing and then making that referral and connection to housing and support. So we know that in most cases, someone who's experiencing homelessness who enters our shelter system is actually able to self-resolve that experience of homelessness themselves. They don't necessarily need a lot of support to exit homelessness. They may be able to secure a private rental unit themselves and move through the system that way, and that's great. However, we also obviously know that there are a lot of people experiencing homelessness who do need that additional support. So for those people, we want to connect them with supportive housing, like I said, with supports that help them to maintain their housing over time. And that process of connecting those people to that housing is really driven by this commitment to prioritization, because unfortunately, despite the city's commitments to creating more supportive housing, there's not enough supportive housing at the moment to meet the demand. So we need to prioritize people for access to those units. And the prioritization approach that we've taken has been co-developed with our community partners, again, has taken kind of direction from all those different municipal strategies, direction from federal and provincial governments to create an approach that really tries to address the needs of people experiencing homelessness who are overrepresented in our homeless population and also may face additional discrimination and barriers to accessing housing themselves. So, there are a number of key population groups, including people experiencing chronic homelessness who we aim to serve, Indigenous people experiencing homelessness, Black people and other racialized people, youth and seniors are key priority population groups, as well as folks from the 2S LGBTQ+ community and women. So they're really the main, prioritization populations, or the priority populations who we aim to serve and connect with housing units. And then we're measuring our success in terms of how many people from those groups we're able to connect with housing, and making adjustments to our processes and programs as we go, based on data that we're seeing through the dashboard that I showed earlier and other kind of measures that we have in place as well. So that brings me about to the end. The last slide is just kind of a link to more information, in-depth information. 20 minutes is not quite long enough to get into all the details. So if you want to find out more, you can go there. And that's it. Thanks.
Thank you so much, Stephanie. It was only 20 minutes, but very informative. So thank you so much. So next we have Sonia Bourgeois, the Director of the Toronto Drug Strategy of Toronto Public Health.
Hello. I have to say I haven't been in the City Hall chambers in over 2.5 years before the pandemic. So, and I've also never stood right here at the podium. So I'll probably start blushing a little bit throughout the presentation, so just bear with me. So I am an acting director at Toronto Public Health, overseeing the Toronto Drug Strategy Secretariat. So a big part of the presentation will be focused on what the drug strategy does, but I did think it would be good to talk a little bit about Toronto Public Health, sort of how it's situated within the city, and so a little bit about legislation and how Toronto Public Health works. But first, if we could just move to the next slide. sort of in keeping with the opening, and thank you for the opening and the land acknowledgement, we also have a land acknowledgement. I won't read every detail, but I think the piece here is that so much of our work is grounded in truth and reconciliation and working very closely with Indigenous communities. And then similarly, we also do a lot of work with African, Caribbean, and Black communities and populations. And so we do have an African, Caribbean, and Black acknowledgement as well. And I think, you know, it's really about me identifying that I'm not from this community, but my commitment and our commitment as an organization to work in solidarity with Black communities, and also recognizing that many people from African, Caribbean, and Black communities didn't necessarily come to Canada in the same ways that other communities have. So we'll go to the next slide as well. So we are facing a drug poisoning crisis in the city, and I will talk about that in greater detail. And I know some of you may know that, and some of you may have different levels of understanding. But it's really important first to acknowledge that we are in a drug poisoning crisis. And so because we're the Toronto Drug Strategy, we open all of our meetings with this acknowledgement. And so it's really around acknowledging that there have been tragic and substantial losses that people continue to face due to the drug poisoning crisis. And I will talk about that, but that these losses and grief really are immeasurable. And that this crisis is rooted in systemic discrimination. So we'll talk a little bit about that this morning, but also that, you know, we will talk about, or I will talk about data, and just recognizing that data behind those numbers are people and families and communities who have been lost. So we'll move to the next slide. So a bit about me, and thanks, Steph, for, you know, it's my first time meeting Steph and Kenshin as well, so it's always nice to meet new colleagues at the city. I have a background in social work, similar, sounds like some similar path to Steph. I have a master's in social work, and I started my career working at a shelter for women fleeing violence in the west part of the city. Very informative for sure, and honestly, when I do my day-to-day work, especially when thinking about the drug strategy or working on issues facing marginalized communities, I often put myself back in the shelter and thinking about the families and the women I worked with. But my social work lens came from having an understanding of clinical skills, but honestly, I spent a lot of time in my master's doing research, so doing thesis, and also I had a couple of placements as a researcher, and I honestly really leveraged that to move into more of a policy role. So I have micro level social work, just thinking about working frontline with individuals and communities, but also a lot of my work is grounded in a macro level understanding of systems and policies and how they impact people and communities at a larger level. So I spent about 8 years working for the Ontario Public Service, the provincial government, in a variety of portfolios, all doing policy development, largely in health, and also social policy, working on violence against women at the Ontario level, which was quite meaningful to me. And then I used those policy skills to come over to the city and work at Toronto Public Health. So I've been at Toronto Public Health for just over 3 years. So if you might imagine what I've spent the last few years doing before moving to the Toronto Drug Strategy, it was actually focused on responding to the COVID-19 pandemic, which I know impacted all of us in different ways. So the next slide. So who is Toronto Public Health? So Toronto Public Health is the largest public health unit in Canada and the 4th largest in North America. And so I find public health often a bit abstract, hard to explain. So I thought it'd be good to give you a sense. So we have a medical officer of health. Her name is Dr. Eileen Davila. And when she thinks about the patient is the city. And so we report to the Board of Health. Actually, our board chair is here, Councillor Joe Mihevc, just over there. And we're responsible for the health and well-being of the whole city, so all 2.9 million residents. And generally and broadly, our work relates to preventing the spread of disease. So you could think about COVID-19 as a very tangible and concrete example. Using surveillance, so thinking about data to monitor the health status of the population, How are we doing as a population? And then, of course, developing and implementing public policy, both at the municipal level, but also influencing other levels of government, the province and the federal government. Next slide, please. So public health is unique to a division of the city. So we are funded actually 70% by the provincial government and 30% by the municipal government, which is quite unique. So different, for example, than Steph's area, SSHA. We are established through provincial legislation. I won't get into all of it, it's quite technical, but it's called the Health Protection and Promotion Act, and that allows us to establish a board of health. And we're overseen by a board, unlike other divisions in the city. We also have provincial standards. They're called the Ontario Public Health Standards. And that really informs a lot of our work. And those standards, for example, state that as public health, we need to address substance use and substance use prevention, which is how we have the drug strategy. So we'll move to the next slide. This is going to be very small, and I won't go into it, but if you see the blue box just outlined on the left, sort of center left, that gives you a sense. This is the org structure for the whole city. So you can see sort of where public health is situated. We're under community and social services, along with shelter support and housing. I keep looking at Steph, but I know she's just one person in the division. Also parks, forestry, and recreation, and other social programs, just as an example. So next slide. And this is sort of a focused view, as mentioned. So we have City Council at the top. The city manager is, of course, the head of the Toronto Public Service. There's a deputy city manager overseeing community and social services, and then public health under there. And Dr. Eileen Davila, as mentioned, is our medical officer of health. We'll go to the next slide. So we do have a Board of Health. I won't get into it too much, but the Board of Health, for example, generally meets monthly. And as Toronto Public Health, we bring reports from the Medical Officer of Health to the board on a regular basis. So, for example, if we have a big strategy that we need approval on, that would go to the board. And often, the board advises City Council on a broad range of health issues. So we're quite unique in that way. So I wanted to just to share that. So if we'll go to the next slide. And I won't go into too much detail here. We'll get to the meat of the presentation, but City Council appoints Board of Health members. So the Board of Health is made up of councillors, members of the public, and also members from the education, so from Toronto District School Board, as an example. So we'll go to the next slide. Okay, so Toronto Public Health interim priorities. So now that you know a little bit about the board, we did provide a report and an update to the Board of Health in May of this year, or sorry, I believe it was June actually. And we talked about, okay, we're coming out of the COVID-19 pandemic. We're recovering as a city. We're also honestly recovering as an organization. Many staff were redeployed. And so to the board, we did provide an update on our 4 organizational priorities for the next year. And those priorities include continuing to respond to the COVID-19 pandemic. It's still with us, and so public health still continues to play a role there. Promoting mental health is a big priority for our organization moving forward, given the tremendous impacts that the pandemic has had on mental health. The third priority is responding to the drug poisoning crisis, so I will talk about that. And finally, rebuilding public health functions, recovering from the pandemic. So next slide. So the Drug Strategy Secretariat. So we are situated within Toronto Public Health. What we do is we provide project management, research, policy, and administrative support to advance drug policy in the City of Toronto. We're also closely situated with a part of our organization called The Works, which actually delivers harm reduction services, supervised consumption services, and a number of other programs to support people who use drugs. My team basically leads the implementation of a number of recommendations and strategies. So we have the drug strategy as a whole, which guides our work. We also have a few overdose action plans, and we regularly report to the board. And we, of course, play a key role in fostering relationships across the city. Toronto Public Health isn't the only organization that is working in this area. Next slide. So I think it's important to talk about the social determinants of health, also given that as students, you're probably thinking or your areas touch on a lot of social determinants of health. So when we think about Toronto Public Health, again, it's different than a doctor-patient relationship. It's more on the macro level. So at Toronto Public Health, we're thinking about the health of the whole population. And then, of course, health is influenced by many different factors, which we call the social determinants of health. So access to housing is a social determinant of health. So really nice intro from Steph before this presentation. Gender, Indigenous identity, disability, food security, these are all social determinants of health and really impact the people of the city and the work that we do. Next slide. So the drug poisoning crisis, you may have heard there's a lot of coverage in the media, but over the years, it started as an opioid crisis. I'm sure many of you have heard of that. And now we're referring to it actually as a drug poisoning crisis. And what this means is people are dying of drugs that they're taking. And often it's because the drug supply is contaminated. And often people take a drug thinking it's something that it isn't. And so we are facing a number of fatal and non-fatal overdoses in the city. So Toronto Public Health, we monitor and we try to have a sense of how is the population doing. So a big part of our role is looking at the data. And so unfortunately last year, 560 people died in 2021 related to the drug poisoning crisis. And so the deaths are from all substances, so including opioids, but we saw a significant increase in drug poisoning deaths throughout the pandemic, and those continue. And in part, it's related to the unregulated drug supply. So we'll go to the next slide. So similar to SSHA, we do have a dashboard. It is publicly available. It's called the Toronto Overdose Information System, TOIS. The city loves acronyms. And so you can go and look to see, where are the larger proportions of deaths or non-fatal overdoses in the city. So as a result, as an organization, we also try to develop our strategies based on this data. And so, just from that tiny snapshot, you could see a large majority of the overdose deaths are actually in and around the downtown core, but also spread throughout different parts of the city as well. Next slide. So just a touch, I won't go into it, but the Toronto Drug Strategy is a small but mighty team, quite a busy team, and we have a number of strategies. And so the city does love strategies, but it's in part how we demonstrate our accountability to the public on what we're doing and also bring together a variety of partners. So we do have the Toronto Drug Strategy itself. We do have, as mentioned, the Toronto Overdose Action Plan. We initially launched that in 2017 and updated it in 2019. We do have a very specific and unique Toronto Indigenous overdose strategy, working very closely with Indigenous partners and working to ensure that action plan is Indigenous-led. And finally, in January of this year, we did apply for an exemption to Health Canada to allow for the decriminalization of the possession of drugs for personal use. And I can talk a little bit about that. It's different than legalization. It's essentially asking for permission from the federal government for people who use drugs in the city to not be charged when they're in possession. And we can talk a little bit about that. Next slide. These are the sort of key action areas. I thought it would be nice to kind of give you a sense of the breadth of the work that we're doing. So as mentioned on the top left there, we are continuing to implement a number of strategies. In the top middle, we're applying for an exemption to Health Canada, as I just mentioned. On the top right, we're working really hard to continue to expand the number of supervised consumption sites and the harm reduction services in the city. In the bottom left, we are continuing ongoing efforts to monitor the local trends of the drug market. So we, for example, have a partnership with a program called the Drug Checking Program. And what they do is look to see what's inside the drug supply by testing samples. And we're constantly trying to monitor how the drug supply is changing. We are also implementing new programs. They're quite new, called Safer Supply programs in the city. So we can, I'll go into detail about the works, but Safer Supply is basically an opportunity for people to access prescribed medication from a physician that can replace the drugs that they're accessing on the street that are not safe. And finally, on the bottom right, we're doing a number of consultations right now. It's been a busy summer and fall. We're updating the Toronto Drug Strategy for 2023, and then we would bring that to the board for hopefully, fingers crossed, approval on some new actions. So on to the next slide. I thought it'd be nice to show a sample again of a drug alert. So sometimes this catches media attention, but our role at Toronto Public Health is also to inform the public of potential things that are not safe. So taking it out of the drug portfolio for a second, I think many people know that a restaurant usually has a sign in Toronto that says, you know, it's safe to eat here. That's public health. That's a good example of the role of public health, you know, going in and inspecting from a health perspective. And similarly, on our end, we're looking at drugs. And if there's a warning that people need to know, we often put out what we call drug alerts. And so here's an example, and we're currently working to update these as well. Next slide. I promise I'm almost finished. Just thinking about decriminalization. So it's a complex subject, and certainly even for me when I was learning about it and learning about the portfolio, it's the idea of you know, the criminalization of drugs and treating drugs as a criminal issue has not necessarily been effective. People still use drugs, it's increasingly unsafe, and so why not treat drug use as a health issue instead, recognizing people need access to social services, people need access to treatment. And so, as mentioned, we have applied to the federal government, so it's under federal legislation. We've asked for an exemption for the whole city. From a policy perspective, this has required a ton of work. What will the exemption look like? Does the mayor support this work? What about other city divisions? What impacts could this have for us? But most notably, the whole province of BC recently received approval on exemption in the spring. And so that's historic. And the idea is if people aren't afraid of being charged by the police with using drugs, they may be more open to asking for help or accessing services. And so this is a huge amount of work. The one thing I'd like to just say is also, we do know from the evidence that African, Caribbean, Black communities, Indigenous communities have been disproportionately impacted by criminalization and by drug criminalization. So a huge part of our work is also working directly with those communities to make sure that what we're putting forward is supported and makes sense to them. So the next slide. So just a snapshot on the works. It's operated by Toronto Public Health. It's located really close to Toronto Metropolitan University, really close to Dundas Square, and it is a place where folks who use drugs can go for a number of reasons. They might need clean supplies. They might want supervision while they're using drugs, and part of that is also around the overdose risk. And so being supervised by a nurse or a physician, you know, in the case of an overdose, they can receive attention immediately. But the works also is trying new programs. Like I mentioned, Safer Supply. So people do go to the works to access what we call injectable opioid agonist therapy. And it's a replacement. And with that, they also get a range of social services, sort of wraparound services, connection to healthcare or potentially housing, getting put on a housing wait list, et cetera. So the Works is a very important program. And given that the drug strategy works on policy, it's really important that we work regularly with the Works to understand sort of what's happening on the ground and what people who use drugs need. Next slide. And I think this is the last slide, but given that this session is about people, community, and neighborhoods, it's really important to think about services and programs. What do people who use drugs need? And that these services and supports need a few things. They need to be evidence-based to know that they're effective. They need to be equitably accessible for all. So for example, do people feel safe accessing programs? They need to be trauma-informed and client-centered and culturally safe. And an example of service and programs in Toronto, and again, it's not all operated by Toronto Public Health, but our role is to sort of coordinate or advocate for more programming. And so it's supervised consumption services, urgent public health needs sites. These are federally funded, but they're sort of low barrier supervised injection or consumption sites that can be set up, for example, in shelter locations. Integrated prevention and harm reduction initiatives. We do know that a large proportion of overdose deaths or non-fatal overdoses are happening in the shelter system and among the homelessness population. We also need drug checking. Where can people go to make sure that the drugs they're using are safe? And also, of course, most importantly, people do need access to treatment and treatment that's timely when they're ready to access treatment, and safer supply. So there is growing momentum out there in terms of more and more programs and physicians that are getting on board with wanting to offer safer supply programs. So just to be clear, prescribed safer supply programs. So the next slide, I think, is the thank you. Oh no, I'm remiss. The next slide is about other strategies. So I think it's really cool that Steph presented on the housing TO and talked about housing TO. So in the drug strategy and thinking about the social determinants of health, all these issues are connected. And so how do we at Toronto Public Health work closely with other divisions in the city and make sure there's alignment? And so there's some examples here on some strategies at the city. Next slide. This is the thank you. So I just want to say thanks for your time today. And then if you go to the next slide, there's some very helpful sort of links embedded where you can go and read more information. We have a YouTube channel. And yeah, I just want to say thank you and also give a shout out, even though she won't like it. A member of my team is here named Kirthana, and she helped me prepare the slides and did a lot of work behind the scenes. So just wanted to say thank you to her and thank you to you all for having me.
Thank you so much, Sonia. Thank you for so clearly explaining such a sobering topic with such care. Next, we have Kanchan Maharaj, Senior Engineer of Cycling and Pedestrian Projects with Transportation Services.
Okay, good morning, everybody. So my name is Kanchan Maharaj. I'm the Senior Engineer in Cycling Pedestrian Projects in Transportation Services, and our unit is called Project Design and Management. So we are responsible for delivering cycling projects in the Cycling Network Plan. Next slide. So I'm going to talk a bit about what we do and who we are. So the Cycling and Pedestrian Projects unit is 28 staff members, and our unit also includes Vision Zero, neighborhood projects, and major projects. And we are responsible for the Cycling Network Plan as well as the Missing Links sidewalk program, which is the pedestrian part of our unit, but also pedestrian realm and public realm elements that are combined with our delivery of our cycling projects. My role is the senior engineer in the unit, and I am responsible for managing our contracts that we deliver and manage ourselves. So we have a line marking contract, and we have a bollard concrete contract, as well as we deliver traffic signals that are related to cycling projects as well within our unit. My background is I've worked in the public and private sector for over 25 years now, as well as in transit with TTC, nonprofit sector, a bit of international development. And I have a planning and engineering background, as well as construction. And what I love about my role is I get to use pretty much all of that most days, if not most weeks. I'm also an immigrant and from South Africa, and I use she, her pronouns. Next slide. So a bit of an overview of what I'm going to be talking about. So building on what Stephanie and Sonia have already talked about as it relates to active transportation within neighborhoods. And an overview of the history of the City of Toronto Cycling Network Plan and how we incorporated equity metrics into the evolution of the plan and into the delivery of our projects. And depending on how quickly I speak and not running out of time at the end, I might touch on 2 case studies that show everything that I've talked about in Mount Olive and the Flemington Park neighborhood. I'm also going to use a bunch of acronyms throughout. So CNP is Cycling Network Plan. And when I talk about NEIs, they're neighborhood improvement areas. So I'll explain what those are when I get to them. Next slide, please. Historically, the construction of cycling infrastructure in Toronto has been bundled with road projects. So whenever a road is being reconstructed or resurfaced, we would try and hop onto that project to include cycling infrastructure with those projects. And that has also resulted in a very disconnected network throughout the city. We have little bits all over the place that were built during opportunistic opportunities. In 2016, we created the first major cycling network plan, CNP, and it was still based on bundling opportunities. And that left us very vulnerable to those bundling opportunities being canceled and us being left with a further disconnected network. The intention of our plan is to connect what's out there, renew things to bring them up to current standards, as well as to grow the network out into the areas of the city that have been historically underserved. After the 2016 plan, we realized that we need to be more reactive in what we do. And we also need to be able to take advantage of opportunities as they come and look beyond 10 years and look infinitely out to try and assess all the potential routes that we can build. In 2018, we did a major update of the plan. And we tried to address issues with the 2016 plan. On this slide, in the top right corner are the metrics that we used in the first plan. So the 8 ones that I've circled in the blue box. The ones that are in orange are the ones related to equity. And then in 2018, 2019, we added a specific equity category that I'll talk about a little bit more. And we also enhanced the methodology that we use for the 4 orange categories. We also used a new tool that the city's developed called the Equity Lens tool that came about in 2018, 2019 to help inform and identify barriers experienced by equity-deserving communities throughout the city. Moving forward, the network plan will be a short-term plan, which is 2 to 3 years that the unit I'm in is responsible for delivering, as well as a longer-term plan, which isn't 10 years anymore, it's infinite out to the future, and then a major citywide route plan. Previously, the near-term plan was 2019 to 2021. In the current iteration, it's 22 to 24. And it's a rolling plan that we keep every year, pretty much every year. We analyze and we analyze every road in the city for potential for cycling infrastructure. Also in 2019, something happened within transportation in that we went through a reorg and we moved the responsibility for planning of cycling into a new unit called the Capital Programs Unit. And that unit is now responsible for planning the entire transportation division's projects, so that cycling is now considered on every project, as opposed to being separate from transportation. And I'll talk about more of that later and how we are changing the transportation budget. But it also initiated a shift in responsibility for cycling, out of cycling. I'll talk a bit more about that when I get to maintenance, but historically, when a sign or a signal or a line on the road was associated with cycling, it was looked at cycling as opposed to transportation. And we're trying to change that. It's not special, but the paint on the road, the signs, everything isn't special because it's cycling. It is still transportation infrastructure. So we're working on shifting cycling to be considered broadly through transportation as a mode that people use to get around the city. Next slide, please. In our 2019 plan, we used a lot of information from the Toronto Strong Neighborhood Strategy 2020. There are 140 social planning neighborhoods throughout the city. That might be changing. There's 31 of those are designated to be neighborhood improvement areas, NIAs. They're essentially neighborhoods that have been historically underserved, left behind, underfunded. And there are planning tables for each of those neighborhoods. Each neighborhood has a community development officer who works with the residents in the city to help make sure that city services and facilities address the neighborhood priorities. Next table, please. Sorry, next slide. In 2019, we went to each of those planning tables and we took big maps of people's neighborhoods and we asked people to identify where their important destinations are in their neighborhood and around their neighborhood. Where do people get to? Where do they need to get to? Where do they want to get to? How do they do it? School, work, shopping, recreation, anything related to how people get around, not just cycling. So transit, walking, driving, however people get around. And what barriers do they experience? But be it safety, lighting, accessibility, costs. Like, we wanted to know where people go and how they get there. And then we took that data to help improve and inform our engagement on projects when we eventually go back to neighborhoods with the cycling network plan. There's a preconception that, especially with cycling, that everybody wants to get to and from downtown. And that's just not true. Most people and most of the barriers are people just navigating in their own neighborhoods to perform their daily tasks and to just survive and get to work and get shopping and get to school. It's like, we do have major wide city routes, but that's not our focus. Our focus is to make sure that people can function in their own neighborhoods. When we did our cycling network plan, we looked at any link or project within a neighborhood improvement area, and we scored every route. So on a citywide basis, if a route that we were scoring passes through or serves a neighborhood improvement area, when we scored that route, it would automatically receive the maximum points at those 4 equity categories. So that would help us float those projects up to the top in our prioritization on where we decide to spend our money. Then we took another, next slide, please. Okay, so this is the point scoring system on the metrics that we used. The red, this is just a snapshot of the last network plan, but the darker colors, the red colors, were the ones that scored the highest. The blue colors are the ones that scored the lowest. And anything that was on the verge, like on the edge of a neighborhood improvement area, we also included that in the analysis of our data. Every 2 to 3 years, we redo this entire analysis. And every 2 to 3 years, we go to council with our cycling network plan to update it and prioritize what we're going to be spending our money on in the next 2 to 3 years. So next slide, please. We then took all of that data that we have and produced this map. This is called a bivariable map. And it shows that the darker colors in this map show the areas that are underserved in the city from both from a cycling perspective and a social equity perspective. The next slide overlays our latest plan on top of this map. And it's one of our checks that we use to ensure that, next slide, please. So this is the near-term plan. And then we took this near-term plan and overlaid it onto the bivariable map on the next slide. And this helps us just make sure visually that we are actually spending our money and focusing our efforts in the areas that are underserved. And we also measure a whole bunch of other metrics that I'll talk about later to make sure that we are doing what we say we're going to be doing. So next slide. This is just a summary of the steps that I've already talked about and the steps that we take to make sure that how we prioritize our projects. So we compiled the list, we prioritize them, and then we looked at how constructible everything is. And we go back and forth to float the top projects up to the top. And all the way along for each of these 3 steps, we're looking at equity at every step along the way. Next slide, please. This is one of the metrics that we're using to verify that we are doing what we say we're going to be doing. So in the previous cycling network plan, this is a measurement of how much money and how much infrastructure we are delivering in neighborhood improvement areas versus outside of neighborhood improvement areas. In the previous South Cycling Network plan, it was 1.5 times more. In the current one, it is 2 times more in the NIAs compared to outside of the NIAs. Next slide. Something I talked on briefly earlier is how transportation has been reorged. We are the first, or we were the first division, at least in 2020, to put an equity lens on our overall budget. And the staff who were in cycling and who worked on the cycling network plan are now in that unit, and they're applying the same metrics and the same thought process and same type of analysis and data to the largest transportation budget. And it's still a work in progress, but it will impact which roads and corridors are programmed on a larger citywide basis, which roads get fixed, which Vision Zero corridors, service requests, and all of that sort of thing. We're still working on it, but it is in progress. Next slide, please. I'm going to touch briefly on the consultation process. So as I mentioned previously, when we go out, when we first went out for the cycling network plan to all the neighborhood tables, we collected a lot of data. We then use that data again when we go out again with each of our projects. Typically, our consultation process starts about a year before implementation. Some take longer, some take less, depending on how complex and how large the project each is. Each of our projects needs to go to council for approval with all of the associated bylaws and a report on the consultation before we can implement anything. So everything that we do, all the cycle tracks and bike lanes require council approval, along with all the turning restrictions, parking removals, all of that. That changed slightly for 2020 during the pandemic, which hopefully we'll talk about later, but that is the process back again that we have to do now. We've learned a lot of lessons over the years, and we're still working on our consultation to try and get better at it, and especially paying attention to who we're hearing from and who we're not hearing from. And I may not get to the case studies, but the slides are in here if you want to see the data on the case studies on what we learned and how we're trying to improve. But we learned through a lot of trial and error, as well as things that Stephanie and Sonia have also talked about, that the community and end users have to be involved in the decision-making process, because there is no one-size-fits-all solution to anything that we do. And we're still trying to improve on our consultation process, but a lot of what we do now is tailored for each project in each neighborhood, and making sure that we don't go into any neighborhood with a solution beforehand, that we try and work with residents to develop our solutions before we go to council. Next slide, please. This is just a brief summary of some of the common issues in neighborhood improvement areas, because they're typically in suburban areas outside of the downtown core. Wide road widths, wide lane widths, a lot of mid-block destinations with no safe crossings, signal timing issues for people who are disabled and for seniors, high speeds because of the wide traffic lanes and because of the wide roadways. A lot of painted bike lanes. Historically, before amalgamation, each district did things differently, and a lot of the suburbs did things in paint. And that's one of our renew goals now, is to go out and start bringing them up to current standards. Next slide. So the next couple slides are the case study. So I'm going to just skip this first one. Keep going. I'm running out of time, so I'm just going to talk about the Kipling one. So I think that's this one. Okay, we'll do this one. So Kipling is, Kipling Avenue in the northwest corner of the city is in Ward 1. And it's similar to the other case study that I didn't talk about, which is Flemington Thorncliffe. High density, many languages, high immigrant population, high 24-hour transit ridership. And there's a 2.5 kilometer multi-use trail along the east side of Kipling Avenue that was constructed in 2020. Typically, we don't do a full engagement if there's something already there, and there's no change in the infrastructure type. Mostly due to capacity and speed, because if we want to get on these projects, we have to do them, we have to know at least a year in advance of the construction in order to get it bundled with a large project. So Kipling was, it was originally supposed to be a resurfacing. So a resurfacing means that we cannot move the curbs. We're just resurfacing between the two curbs, and we can only do whatever we can fit. when a road reaches a reconstruction stage, meaning that the underneath the roadway, the subbase has started to fail, the price goes up a lot, 3 to 5 times more for the road part of it, but it also gives us more opportunities to do something more substantial as far as active transportation goes. So in the time that we were doing this project, it changed from a resurfacing to a reconstruction. Next slide, please. This talks about some of the things that we can do for resurfacing versus a reconstruction. But by our current design standards, that 20-year-old multi-use trail should have been a bidirectional cycle track. That was our current guidelines at the time. But because of local knowledge in our group, as well as going out and doing field visits and watching how this infrastructure was being used, that there were a lot of groups of families that used this multi-use path. Even though it has a sidewalk on both sides, there was so much pedestrian volume and a lot of people going out for evening walks as groups that we realized that a cycle track would not be the appropriate solution for this area. What we did instead is that we upgraded the multi-use trail, we upgraded the sidewalk, we made the bus stops accessible, but we also installed bicycle signals. So in the future, if the mode shift changes or if the cycling demand increases, we can always make this a cycle track. But for the current time being, we realize that what this neighborhood needs is better walking infrastructure and better infrastructure for people and families to do what they were already doing in a safer environment. And a lot of what came out of this and why this happened is because of the staff and the decision makers within our group being able to, having local knowledge and being able to change the guidelines and not do what the guidelines say we should have done in this situation. The next slide, please. Just going to touch briefly on maintenance, and then I'll close this off. So as with most cities, I think if anybody's watching social media or anywhere, you know that we have challenges with maintenance in the city, not just transportation, but various places. And myself and our unit, we believe that we should not build things that we cannot maintain year-round, especially for cycling. Toronto is not just a summer cycling city. The next slide. There's a tool that was released in the last couple of years that 311 has. You can all go there and look at this data yourself, but it helps visualize something that we've known for a long time. There are areas of the city that produce a lot of 311 requests, and there are areas that don't. And it's something that came out of our 2018 cycling network plan when we went out and talked to people, is that many people and residents in NIAs don't bother reporting deficiencies for many reasons. And things such as it won't get fixed anyway, it's been like that for years, nobody cares, they don't have time, people have more important priorities than sending in 311 requests, and other systemic barriers to doing this reporting. This data is live on the internet. You can go and check it anytime to see where the requests are coming from, what types of requests there are, filter them out however you want. I'm not going to talk too much about that because the data is there. The next slide, please. And just briefly on maintenance of infrastructure. So now the maintenance of cycling infrastructure has been shifted to larger transportation infrastructure. We're still working on processes and procedures internally so that our staffing is better equipped to inspect and respond to cycling repair requests at the same priority as non-cycling requests. And Toronto does cycle year-round. This data I have from March in Vancouver versus Toronto show this is just bike share ridership, but it's fairly close. And there's really only maybe 2 to 3 months in Toronto where it's not really comfortable to cycle. It's a common misconception that we have winter like 6 months of the year in Toronto. We don't. It's maybe December to February-ish where it's a little iffy to cycle, but if the bike lanes are cleared, and we do have better standards for clearing bike lanes now that are at a higher level of service than the roadway. And as long as we can keep up with that, it's fairly comfortable to cycle in Toronto year-round, as long as you're dressed and equipped properly and your bike is safe to do so. But I know many staff in our group and myself, we just use bike share in winter, just because they're little tanks. And they work fairly well when they work. And there's also a data that you can also go and look at the bike share bot as well to see the ridership. So even on January 20th or 25th this year, when that major snowstorm happened, during that week, there were still over 1,000 bike share trips every day. So even with the plowing challenges we had during that time, people were still cycling. And Toronto, I think we need to shift that a bit more, and we're collecting more data. Every project we're putting out now, we're putting bike counters on, so we have more data. And over the next couple of years, we'll be able to release and talk about that data just to prove what many of the staff already know. Anyway, that's the end of my presentation. Thank you for your time, and looking forward to continuing the conversation.
Thank you so much, Kanchan, and for the Kipling case study and showing us how local knowledge informs policy and how infrastructure policy comes to life. So this brings us to the question and answer portion of the session. So I'll kick us off with the first question. We titled the session Community Resilience. And the pandemic showed us that we really need to rethink how we design resilient cities, particularly in the realm of social services, homeless shelters, transit, and public space. So what urban design interventions do you think the pandemic has exposed are necessary for us to live in a more resilient, healthier, safer, and more just and accessible city moving forward? So this is for all the panelists.
Go first. So I think from our perspective, from SSHA, like just really, recognizing that importance of housing. So, we know that, as Sonia spoke about, social determinants of health and building that housing with the supports embedded in it that someone needs to stay housed, recognizing that some people may not be able to live fully independently. And so that infrastructure around supportive housing, I think I spoke about it a bit in my presentation around, recognizing that emergency shelter services may always be needed, but really building a resilient city is about building the supports in the community that someone needs to have their own place. And I think, obviously COVID really highlighted that as well, like how important it is to have your own place to stay and to be safe. So yeah, I think that drives a lot of the work that SSHA and the Housing Secretariat do in terms of that infrastructure that's needed.
Maybe just to build on that, I think all of us, regardless if you use drugs or drink alcohol or whatever it may be, I think all of us experienced deep isolation during the pandemic, some more than others, depending on their social circumstances. And so I think when I think about urban design, it's about designing communities that enable connection. And the sense that the more connected we are, I think in general, the healthier we are. But if we also address stigma, everyone deserves to be healthy and feel that the community is designed for them. So I think, the pandemic, just to shine a light, I think, as I had mentioned, we saw a huge increase in drug overdose deaths and non-fatal overdose calls. And in part, I think that was really due to isolation and services being closed. And the pandemic definitely took a toll on the healthcare system. But I think as much as we can increase connection and learn from those experiences, the better.
So from a transportation perspective, as Sonia talked about, during the pandemic, we needed more ways to connect and for people to get around and more options because people were choosing different options based on their comfort and their safety level. Active TO is something that came out of the pandemic. I'm not sure how many people know the history behind how we built so much so fast, but it wasn't really a design. It was a bit of design, but it was mostly a process change that, as I mentioned, we have to go to council for everything that we do, and that can take years to do that. but we were given delegated authority during the pandemic to just go out and start building things. And a lot of these routes that we built, like University, Bloor, Danforth, even Bayview, they were already vetted through our cycling network plan. And what we were able to roll them out quickly because we knew that they could work. And with the delegated authority, we built them quickly. We were given authority to just go build it, do iterative changes, like do the consultation, do what you would normally do, but you don't need council approval. And then we would make changes and make it better along the way. And we would just, everything would automatically get approved, all the bylaws. So I'm simplifying the process a lot, but just cutting that out let us build infrastructure very quickly, and a lot of it. And we've never built that much before in the history of the city.
Thank you for your insights. We'll open it up to the audience. Do any of you have questions? Okay, I see a hand in the back.
Hi. So I was just wondering about earlier about the decriminalization of drugs, and you were asking for a federal exemption, right? I was wondering, hypothetically, what if they said no? Like, what can the city still do? Like, because honestly, like, we could still do our own thing, right? And like, what are they going to do? Send the troops in? Like, what are they going to do to stop us, right? Like, I don't know. I was just wondering about that.
I'm not going to lie, I spent a lot of time thinking about this specific question. I think, there is ultimately, we have to respect legislation, especially as a government, organization. But as I mentioned, you're right. The legislation is federal legislation, and ultimately they set those rules. But at the same time, there has been sort of an increasing move towards decriminalization, even from police services and associations. So we're sort of living in the city of Toronto in something that we call de facto decriminalization. So as much as it isn't quote unquote approved by the federal government, we've seen a significant decline from Toronto Police Service in actually laying charges. And so while it's not the official stamp, it is an unofficial way that we're already starting to see the change. I think when we think about equity, though, and maybe certain populations being disproportionately impacted, I'm thinking about, folks who are Indigenous or Black or homeless, those who are more vulnerable. I think we would ultimately want to see the exemption approved, just so that we had that sense of security and safety. But I think as a city, we're already sort of moving in that direction for sure. And also we're starting to see other municipalities in Ontario indicate interest. So the city of Ottawa, Kingston. So I think the momentum is there and it is growing. So yeah, that's how I'd answer that.
Thank you. I'm on board with what you just said. Yeah.
Awesome.
I'm not seeing any virtual questions, so anyone else, I hand over here in.
Hey, so this is a question mostly for Kanchan. This is a question about the promotion of cycling efforts. And sort of, I know that there's a bit of an adage within transport engineering, which is kind of like what gets measured gets managed. And so as far as like key performance indicators for cycling, what are you doing to like actively measure those inadequacies that we're seeing, whether it's at like major intersections or across cycling paths where there may not be access to crossings, to be able to better advocate for funding being directed towards active transport?
So there are a couple things that we're measuring. We measure before and after, a lot of metrics on that. We have access to things like KSIs, killed and seriously injured data, which is the same data that the Vision Zero group uses to determine the priority of the different types of projects that they do, curb radii changes, speed limit changes, lane width changes. But for us, a lot of our post data is to do with counts and having more data to prove that when we implement these changes, mode shifts do happen. Are you asking more about like the historical, how we prioritize based on past or future?
More on the future perspective, but also in terms of like assessing the potential usefulness of an intersection. For example, in the same way that is done for the time it takes to get through an intersection for a car, you know, what that time differential might be for a bicyclist, depending on the size of the intersection or the accessible crossings, et cetera.
Okay. So when we do the signal designs and the intersection designs, like a lot of signals of major arterials and arterial roads, bridges, highways are major barriers to people cycling. And when we don't, something I didn't touch on in my presentation is we don't measure current cycling volumes as a metric to determine whether a route should be there or not, because there's likely a very good reason. We look at connections and destinations and connecting what is out there. And like a lot of people ask, like, how many cyclists are using it? How many cyclists? Like, it doesn't matter. It really doesn't matter. It matters after we build it, what's the potential and how much potential and how many connections can we make? And when we move through an intersection, I mentioned cycling signals that we also do that. We go and redo the intersections as part of our projects as well and make them safer for all modes. Because I think it's widely known that when you make an intersection or a roadway safer for people cycling and walking, it's intrinsically safer for everybody, for people driving as well. So those are some of the metrics. I don't think I answered fully your question, but if there's more I can add, let me know.
Great. Anyone else? Dr. Diamond.
Yeah, hi. Steph, this is for you. And I mean, you work in a you all work in difficult spaces. You work in a particularly tough space. And I'm wondering, sort of thinking forward around strategy around homelessness, what patterns are you seeing? How are you gathering data about changes in populations? I mean, we know that there's, you know, a fiscal crisis that's looming, more and more people who would not historically become homeless, potentially facing that. And so curious about how you're thinking forward, and then what kinds of more strategic changes would you like to see at the city level, like bylaw shifts, ways of thinking of rooming house regulation, because there's a population clearly that needs a lot of support, but there's also a population that is impacted by shifts in just sheer economic impacts who could manage housing if it was available. So that relationship between sort of data gathering, analysis, and future thinking, and then new strategies that could help. Thanks.
Yeah, thanks for the question. So in terms of kind of overseeing and monitoring those changes in population groups, if you look at that shelter system flow data, there's a second tab that can be filtered by some key population groups. One of those population groups that I draw your attention to when you look at it, and it's very obvious when you look at the graph, is the refugee population. So certainly we saw pre-pandemic a huge increase in refugees accessing shelter services in the City of Toronto. The pandemic and the closure of the borders saw a significant reduction in refugees accessing services. And as soon as the border reopened, we start to see that number going back up again, and you'll see that in the graph. And that's really been one of the, you know, biggest challenges, I think, for Toronto's shelter system, is to understand the impact of that and to kind of identify the solutions to that. And I think kind of then moving to the second part of your question is really the solution has to be a multi-government solution. It's not a City of Toronto solution alone. It's a federal government solution and a provincial government solution too. And there are responsibilities there. So I think, like, in terms of the shifts that we would need to see, is some of those shifts in terms of, you know, for the refugee population specifically, how are refugees settled when they arrive in Canada, and what does that look like, and what are the supports? Because you're right, not all of those people necessarily need intensive supports. But they do need help in navigating a system. And I think, you know, language barriers, obviously, and cultural barriers are going to play a huge role in their ability to do that. I think in terms of other kind of system level work and outside of supportive housing, like the commitments I think that that Toronto has made to building more supportive housing have been great. And I think we've seen those commitments from the federal government as well. I think there's a huge amount of people who are experiencing homelessness because of poverty, not because of mental health, not because of drug use, not because of these kind of typical things that when people talk about homelessness, they talk about these things when really for a lot of people, especially people who are on OW and ODSP, so Ontario Works and disability, is a poverty issue. And so changes, to those levels of subsidies that people are receiving, the amount of money that people are receiving on a month-to-month basis will make an enormous difference in their ability to pay rent, and their ability to actually be able to afford to live in the private rental market. So, certainly that multi-government response is really what's going to be necessary to affect broad change, while I think the city can then focus their efforts on the supports and specifically more intensive supports that are needed. And I guess the other thing that I would just highlight is the role of the healthcare system as well in terms of that work. So, lots of people who have been experiencing homelessness for extended periods have significant health needs, and we need our partners across levels of government to provide those health services to people when they are experiencing homelessness, but also once they move to housing. And that's really critical.
I will now hand it over to my students, Malak Ghaffar and Brandon Terry, to provide a brief thank you.
Okay, so good morning, everyone. It has been a very insightful City Hall session this morning, and we're all very excited to be here. My name is Malak Ghaffar, and this is Brandon Terry, and we're both urban studies students from the University of Toronto in Professor Mira's class. So we just wanted to come here and wrap up this session by summarizing some of the key points that the speakers have mentioned. Firstly, I want to highlight how this topic of community resilience and homelessness has been one that has been the most asked about for the past few sessions, just because of how important it is. And that's where I think Stephanie's presentation about the SSHA's service policy plan was really important, because I feel like the plan's goal is not to just reduce homelessness rates in the short term, but rather to mitigate community resilience problems and homelessness problems in the long term. The way the plan identifies the diversity in the homelessness experienced by different people, and kind of just explores all their different needs and priorities to provide more targeted solutions. And also how there's 2 extra steps in the plan, which are focused on just creating, building, and maintaining secure and stable institutions that can ensure that these homelessness rates are permanently reduced rather than just reduced for short term. Means that overall there is a reduction in both new and recurring homelessness rates, and that this homelessness problem is not just a recurring problem every year, which is ultimately the goal of the City of Toronto. So thank you so much for that presentation. And I'm going to pass it on to Brandon for the other points.
Good morning, everyone. As Malak mentioned, my name is Brandon, and one of the topics I found very interesting from this session was the emphasis that Sonia put on the social determinants of health, and within marginalized communities, especially racialized and impoverished communities, dealing with drug and substance abuse issues. And I feel like these are really important issues to really consider, as we often forget or undermine, or often forget, or we overlook the causes of many abuse issues. And the recognition of drug and substance abuse within non-marginalized communities is also important too, because we're trying to look out for all citizens and all Torontonians. And drug and substance abuse, at the best, if we can try and mitigate that, we can do the best we can. And the final point I did want to make was that, you know, I like how you said that it's important to not only provide resources for these racialized communities to dealing with drug and substance abuse, but it's also important to make them feel welcome, make them feel that they can reach out to someone they can talk to and try and solve their issues, right? And then the final topic that really resonated with me was Kenshin's topic on bike lanes. And this really resonated with me because I identify myself as an urban biker within the city of Toronto, and as well as a bike share TO member. And over the summer, I've been biking a lot, as well as I still plan to do so even during the winter. And having safe roads and safe areas for biking is crucially important to me, as well as even just looking out for the safety, not only myself, but for other bikers and cars as well. And I feel that by implementing more bike lanes in areas of the city that are lacking bike lanes is really important, because with more bike lanes, we feel that we could have everybody could be safer. You can safely navigate the city while also safely enjoying the city and its natural beauty as well year round. And so I thank you for your presentation on that. And finally, I just want to say on behalf of the University of Toronto and all the other institutions here present, as well as students and staff, we'd like to thank our speakers of Stephanie, Sonia, and Kenshin for this wonderful session today, as we once again thank our professor from U of T as well as the other attendants here. And thank you guys.
So thank you, everyone. We look forward to seeing you at our upcoming sessions. So our next session will be on November 4th, where the discussion will focus on art, culture, and the public realm and city building. And lastly, if you are a student from U of T or OCAD or York, remember to connect with a student from an institution other than your own for your reflection assignment. And you can do that here today in the council chamber or via the Google Doc that the professor shared with you. So thanks again, everyone.
And don't forget to sign in if you haven't already done so.